Good morning. It is so exciting to welcome you to Stanford Medicine X, the most discussed general academic medical conference in the world. We explore the intersection of emerging technology and medicine based on three pillars of innovation: people, technology, and design. And most importantly, we're an academic medical conference designed for everyone. So, wow, it's been an amazing year for Medicine X, and this is just day one of the conference. So, let's see, what happened this year? Well, we did Medicine X pop-up events in New York, Los Angeles, Austin, Texas, Boston, Massachusetts, Phoenix, Arizona. We met so many friends in so many cities across the United States and started new conversations that I know will continue here at Medicine X over the next 3 days. We added new members to the MedX family, which is always growing, many of whom I see here in the room today. We ran our new MedX course here at Stanford on 3D printing and biofabrication this year, in collaboration with co-lead for MedX makers, Monica Wittig. Medicine X has been busy actually planning 2 new courses at Stanford this year, 2 this quarter, one on data science for digital health and precision medicine, co-led by our Medicine X faculty for data science, Zishan Saeed, and another new course on evaluating new healthcare ventures. It's kind of our push in Medicine X to venture into entrepreneurship and business and translation of new ideas into real-world solutions. And that course is going to build an approach based on everyone included principles in the spring next year. This year we trained fellows in medical education and digital health at Medicine X and welcomed a new fellow, Ashish Shah, this year, and a new group of students into our year-round Medicine X programs at Stanford. We published an article in the BMJ about the importance of patient partnership in medical meetings, co-authored the article with patients, technologists, researchers, and providers, the people who were part of building Medicine X. And it was more than just a passion piece from us. We offered hard-earned advice about what we've learned in the co-creation of Medicine X and published it as an everyone-included framework and guide for other people to help them in running medical meetings that are inclusive of the expertise all stakeholders can bring to conversations about the future of healthcare. The article is fresh off the presses. Our friends at BMJ were kind enough to put it online for us yesterday, so I encourage everyone to look it up, share it with your friends, and give us your feedback. Give us your ideas. How can other people help bring patients, caregivers, technologists, everyone into medical meetings? How can we do it better? We're still learning at Medicine X, and we want to learn from you. Of course, I can't forget to mention the amazing pre-conference events that have been happening since Wednesday here at Stanford. Raise your hand if any of you have been to one of our pre-conference events. It's like the conference has already been going on for the week. It's just amazing. We started things off with our Blockchain Disrupt co-create-a-thon event in collaboration with Alpesh Shah and the IEEE Standards Association, and help from Leonard Kish and our friends at UBase. We had that event on Wednesday this week. We spent a day imagining a future where technology that underlies the cryptocurrency Bitcoin could be used to power new ways of sharing patient data. And we daydreamed new usages of blockchain for medical research, where blockchain will realize making anonymous and secure sharing of patient-generated data with researchers, as easy as pressing a button on your smartphone. But here's the thing, most importantly, what blockchain will do, it will allow researchers to anonymously contact patients using that same network, to contact participants who, based on their profile, their shared anonymous patient-generated data, meet the criteria for their studies, to recruit new subjects in a similarly seamless and secure fashion. Blockchain in healthcare is going to be something everyone is going to be talking about this year. We're really excited to start that work with IEEE Standards Association, the leading engineering society in the world. So that was really exciting. Wednesday night was exciting, super exciting. We held our first ever event at the Stanford D School, where we celebrated healthcare design with a keynote by Eames Demetrius, director of the Eames office and grandson of Charles and Ray Eames. We had a chance to celebrate the winners of our second annual Medicine X Healthcare Design Awards, the purpose of which is to recognize excellence in healthcare design that best represent our Medicine X design principles and philosophy of inclusive, diverse co-creation and collaboration. And I think you see people dancing. That was one of our award winners. And you will have a chance to talk to those people and meet them here at Medicine X this week. We had an amazing workshop where we continued the important work we started last year downstairs in the basement of this building using simulation to explore the patient-provider communication relationship. We use simulation to spark empathy and reflective learning, spearheaded by our Stanford faculty, Kyle Harrison and Lexi Buchanan, in collaboration with Kendall Whitlock and Katie King from Boehringer Ingelheim. Kyra Bobinette, one of my favorite people. She leads a course that we teach together at Stanford called Engage and Empower Me. She shared her incredible knowledge of the neuroscience of behavior change in a day-long workshop where our MedX community got coaching sessions on how to take the neuroscience of behavior design to design solutions for healthcare. Our Medicine X coordinator of e-patient programs, Sarah Kucharski, worked with our friends Jerry Matzik and Joe Kim at Lilly, joined by Tyler Ludlow and Catherine Rosbach, on a workshop exploring shared decision-making in healthcare. That happened yesterday. Of course, Medicine X would not be Medicine X without Dennis Boyle and our now, I think, iconic MedX IDEO Design Challenge, which was held yesterday at the IDEO headquarters in Palo Alto, where our MedX design philosophy was actually born 5 years ago. And Dennis is one of the key people who helped us create that vision of co-creation and diverse inclusivity. And of course, for the first time ever at Stanford Medicine X, our Healthcare Innovation Summit, our signature day-long event aimed at the entrepreneurship and venture community, was launched again right here on this main stage yesterday. And we were joined by patients, providers, technologists, entrepreneurs, and for the first time, executives from healthcare payer organizations that, when taken together, represented more than 80% of all the healthcare dollars spent in the United States each year. We were here together in this room talking about what are the important problems in healthcare, who should pay for it, how do we use our limited resources. It was a really exciting day of bringing all the right people together in the right room, in the right place at the right time to have those important discussions. So it's been an amazing year, really has. Oh yeah, and I almost forgot, there was that thing that we did that time when we were at the White House. We were thrilled to co-create a day dedicated to exploring how to best partner with participants in precision medicine research. In collaboration with the White House OSDP this past June, I'm so grateful to Claudia Williams. I don't know if Claudia is here. She might be on her way. Nick Dawson as well. I'm sure he's here somewhere, who's chair-elect of our program executive board. They both worked so hard with me and my staff to put together that amazing program and amazing opportunity to bring together an everyone included group of precision medicine leaders from around the world, really, to imagine a future for participant-partnered precision medicine research. And more importantly, really, the most important thing was to form co-creation teams there at the White House and to bring those ideas into reality. So Claudia and Nick at Medicine Next have been working hard to coach those teams, and you'll get a chance to hear more about some of the work that those teams have done since our White House event later today. And I think it's just amazing to see what some of those teams have already accomplished in just the really short amount of time since that event took place in June. Before we begin today, though, I'd like to spend a few moments to briefly talk about our vision at Medicine X. So in front of you or on your seats, you'll see a card. So you can pick up that card, take a look at it. That card is our Medicine X vision statement. It says the following: create a culture of health in which everyone is trusted and respected for the expertise they bring, and where openness and experimentation is the norm, where people have personal ownership of health, individual stories have a global impact, and the patient voice and choice is part of all stakeholder discussions. So I hope you will keep that card with you during your 3 days with us at Medicine X, and then you're going to take that card home with you. And you're going to do this because we spent a little extra money to print it on fancy paper. Feel it, it's very thick, okay? We did that for a reason. We did that for a reason. Number one, it looks official. It looks official. Second of all, it has the Stanford Medicine X name on it, so it looks legit. So that is your membership card to the MedX community, and it's your license to become and act as a healthcare rebel. So after MedX is over, you go home to your everyday lives, and you face those struggles we all face in the healthcare system. When you hit one of those struggles and you meet one of those people who doesn't quite get it, and you are the rebel, I encourage you, just pull that card out of your pocket. Anytime anyone questions your credentials to bring people together, to challenge the status quo, and to create change in healthcare. So if you are joining us at Stanford, tuning in on our video live stream, or following us on social media, I know you share our desire to create a better future for healthcare. Our way of seeing that future through the eyes of all stakeholders of healthcare: patients, caregivers, providers, researchers, technologists, entrepreneurs, industry, and as we saw yesterday on this stage, payers. Together, we believe we can only see the future of healthcare more clearly when we are all looking together, both at each other for inspiration and together towards the future. At Medicine X, we aim to bring people together on equal footing in an environment of inclusivity and mutual respect for the expertise that everyone can bring to fix healthcare. We call this way of seeing each other everyone included. And that means we need everyone in this room, everyone on social media, on the live stream out there, you too. We need everyone to see each other for the people we are and not the letters after our name, not the power we have in the healthcare relationship, not the dollars we might have in our bank accounts. The most powerful lesson we will learn together in this room, I believe, come from the hard-earned expertise of simply being human, living through adversity and challenges, and seeing the value of people to help us uncover and solve our greatest problems in healthcare. Medicine X is a conference designed for everyone, and you belong here. And so if I'm being honest, with all due respect to Lin-Manuel Miranda, Paulberg Hall at Medicine X might just be the room where it happens. So if everyone included is our way of seeing each other, then co-creation is our way of doing. To us, co-creation is more than reaching out to end users of healthcare and asking them to solve problems for us on their own. Medicine X co-creation is true collaboration and partnership that happens when we all come together and work as a team. And that begins with us together identifying the stakeholders in healthcare that are important for the problem we're trying to solve, establish what we need and value, determine how we can each contribute to those efforts, and how we can investigate the use of how technology might help drive that work together. When we combine everyone included way of seeing each other with our co-creation way of doing, we come up with something really powerful and special. After all, that's what's powered the creation of Medicine X. It's that 1-2 punch of innovation superpower. And so it has to have a name, so we picked one. So in homage to Clayton Christensen, I'm calling our MedX superpower disruptive co-creation. It's disruptive because we disrupt the creation process itself by breaking people out of their operational silos. We disrupt by elevating the neglected voices of healthcare, because when it comes to innovation, the majority isn't always right. Disruptive co-creation disrupts because it levels the power structure in healthcare through openness and sharing of information and data resources to amplify knowledge and place the tools for creating solutions in everyone's hands. Disruptive co-creation disrupts because it says expertise isn't exclusive or special. Expertise can come from any person and should be inclusive to all healthcare stakeholders. Disruptive co-creation is disruptive because it creates a culture of shared responsibility and gives everyone the ability to continuously improve, innovate, and advance healthcare. And finally, disruptive co-creation is disruptive because the creation process itself is fueled by the expertise of people that we bring to the table and not by how much power they possess. So with that said, I want to know what your superpower is. Now, and this one I will say won't cut. We asked, I think, on Wednesday for everyone to pick a superpower at the blockchain event, and someone said that their superpower was stealing other people's superpowers. So I don't know that one, but you can steal our superpower all the time, as much as you want. Steal our disruptive co-creation superpower. But once you figure it out, and you will, during these 3 days, figure out what your superpower is. When you figure it out, I want you to do the following. Open up your registration packets. You'll find some networking and creativity tools. One of them is a set of 3 cards. When you figure out what your superpower is, I want you to use that power. I want you to write down an offer of help to other MedX healthcare rebels who are here at the conference. Now, make sure to write down your name on the card so we know how to get a hold of you. And then, because every rebel has needs, I want you to also write down on the other card, the I need help with card, something you need in order to take your healthcare rebel work to the next level. And we have one last card, which is a thank you card, because giving thanks for the expertise, inspiration, and help you receive is one of the greatest gifts anyone can get. And when you're ready, and you don't have to wait until the end of MedX, and I hope you don't wait till the end, clip your card to the MedX community board in the lobby and use the stickers. You should all find little stickers with your cards that have your name on it. Use those stickers and stick them on other people's cards so you can look at all the offers of help and see if that meets some of the things you need. And then sign up, get that help. If you can help someone else, put a sticker there. And if someone's note of thanks really resonates with you, put a sticker there. And I really hope you're all going to run out of stickers by the end of MedX. And if you need more, just ask, we'll give you more. So really, my goal is that at the end of MedX, we should be well on our way to launching a supernova of disruptive co-creation from Medicine X 2016. So finally, I just want to take a few moments to highlight some amazing sessions you won't want to miss at MedX this year. For those of you who've been at MedX for a few years, you might have noticed something new on the lawn outside. You've probably seen a bunch of tents. We're collectively calling them the Hub at MedX. And they have some amazing offerings, including our Everyone Included Precision Medicine tent, as well as our MedX Studio tent. Our demos will be down there. But today, in the Precision Medicine tent, at lunchtime, Maya Upalaru and Amina Shang from the US Digital Service will hold a special lunchtime session for clinicians on the transition to value-based care and explain these new acronyms, MACRA and MIPS, to us. And so I encourage you, if you're interested, to head straight there. Don't go to the lunch line. We're actually going to have food right in their tent for you, so you don't have to worry about waiting in line. You can just get right into their session. Also, for those of you who have purchased tickets, don't forget our sunset welcome reception tonight after the conference ends, which will be held at the Hub from 5 to 7. Also, you won't want to miss our ePatient Ignite talks. Anyone who's been to Medicine X knows these are cannot miss sessions. They're on Saturday and Sunday mornings. And of course, also really excited about our C3 live pitch session, where we will have patients and providers and innovators who are finalists in the C3 prize competition pitch their ideas for changing cancer care to Robert Herjavec, star of the ABC show Shark Tank. Our Medicine X ePatient residents, Michael Sears, will be on that panel, as well as a few more amazing entrepreneurs. And finally, cancel your flights, reschedule all your tickets if you plan to leave MedX before the end on Sunday. You do not want to miss our artist in residence this year, Yoko Sen, who is a sound alchemist. She's going to be giving the closing performance, which would be a new piece of work of sound alchemy based on content, interviews, material that she co-creates with us together at MedX over the next 3 days. So you don't want to miss Yoko. Don't want to miss it. Okay, so I now want to take a moment to really thank the important people that make Medicine X possible. You may not know this, but ticket prices cover less than 1/3 of the cost of putting Medicine X on each year. We wouldn't exist without our sponsors. They're so important for us to be able to come each year to convene an Everyone Included conference, to do our live stream, to include the millions of people who watch here and can't join us at Stanford. So please help me thank my Department of Anesthesiology, my AIM Lab, the IROM group, Astellas Oncology, our friends at Eli Lilly, our friends at Boehringer Ingelheim, Nuance, our friends at the Risk Authority, Johns Hopkins Sibley Innovation Hub, 11 Health, and these important sponsors. And of course, Stanford Healthcare, who has been with us since the beginning 5 years ago. They were actually our first sponsor, and they're one of our closest friends. So with that said, you guys know the rules. You see me once a day. I really believe MedX is about the people who come, people who are here to speak. It's not about me or the AIM Lab or us. And so I come once a day to say hi, and then what we have is Gary, who very graciously does our introductions. So with that, let's get the show started. Thank you so much.